Hi, Dr. Stephen Smith. One of the things we see frequently in the clinic is joint pain, and we treat this with the process called prolozone. We inject local anesthetic and some vitamins into the knee joint or shoulder or hip, whichever joint's inflamed, and then we leave the needle in place and inject maybe 15 cc's of ozone gas, or it's oxygen ozone combination. And within about 30 seconds, most of that ozone has been converted into oxygen and released energy. This energy stimulates the cells to start repairing the joint. We can also add stem cells. We can also add additives such as AmnioFix, which is a placenta extract, and it has about 400 different growth factors in there. This greatly increases the effectiveness of the treatment. This product's expensive, but you can use it or not use it. And we can also inject placental stem cells in the joint as well. This product is even more expensive. We found the AmnioFix works well enough that we rarely use the amniotic stem cells because they have to be held at minus 60 degrees. But the AmnioFixes work quite well. When you add AmnioFix to the prolozone treatment, it acts like about 4 or 5 treatments instead of one treatment because it augments the process so much. But either way, you can use just the prolozone alone and usually have to do 3 or 4 treatments to get effective pain relief, or you can use a combination of prolozone and add the AmnioFix. If you add the AmnioFix, it usually only has to be added once, and then it will work for months. AmnioFix can also be used by itself without prolozone. But in that case, it takes about 6 months before you see an effect versus about a month when you combine it with the prolozone. So the combination is much more effective. In the following, we have some testimonials so you can see the effect of this therapy on different people. I think these are mostly just prolozone alone, but you can see it's been quite effective at reducing back pain especially. It's wonderful in back pain. We have about an 80% success rate with back pain, and we usually don't need to use an additive with it because it's so very effective. With the joints, you have more cartilage to rebuild, so it takes more treatment and more time. The key to this, though, is using a nutritional supplement to correct the nutritional deficiencies that cause the breakdown of the joint in the first place. So watch the following testimonials, and if you're interested, schedule a free consult at our office, and we'll just go over this in detail, and you can make up your mind whether this is something for you or not. Thanks. Robert, you just had the prolozone therapy in your back, right?
Yes, I did.
Just the first treatment?
Just the first treatment.
And we had like 2 or 3 areas?
Yes, we did.
What was your pain level before the treatment?
Probably probably at least a 6.
And how many years have you had this pain?
Since I had my surgery in 01 and 02 for neck and back surgery.
And so what happened after the prolozone?
It was, the injections hurt a little bit, but in the evening, my pain level dropped down to about a 1.
Oh, wow. And did you expect that?
No.
Okay. And that was how long ago? How long did you get relief with that first treatment?
Ever since I've had it.
Oh, it hasn't worn off yet then?
I guess not.
Okay. Do I have your permission to use your testimonial on the
Yes,
unit?
you do.
All right. Thank you very much. Tom, so you've had prolozone therapy on your back and your hips. Would you like to tell us about that?
Well, on my back, I took a couple treatments. If I remember right, it was either 2 or 3 treatments, and it must have been a year and a half ago. And I just got one today, and that was kind of a booster. And when I came in before the treatments, I was hunched over, bent over, could hardly walk. My back was in such bad pain. And after 2 treatments, I had essentially 0 pain. And I'm a contractor, so I walk around and I pick up things that are heavy, and you know, and I abuse my back quite a bit. And so it's been about a year and a half, and I needed a booster shot, and I'm sure it'll take care of it. And on the hip deal, we used some of the amnio on it, and I think I did one side without the amnio, and I was coming back for a second treatment, and we did the amnio, and the other hip started to hurt in the meantime. We did it, and that was about 2 weeks ago, if I remember right. Anyway, the pain went to 0 today. I could just barely feel it yesterday, and there's absolutely no pain. I can walk around, exercise, do anything, and it's gone.
What was your pain level, a 1 to 10 before?
Oh, probably a 4 or a 5.
Okay.
And it started up and gotten to be a 2 or a 3 in the second hip already.
Okay. Do I have your permission to use your testimonial?
Sure.
Thank you.